Understanding Attention Deficit Disorder, ADD. Hey everyone! Welcome back to our channel, Better Life. Today, we're diving into a topic that affects millions of people worldwide, attention deficit disorder, or ADD. We'll be discussing common symptoms, identifiers, diagnosis, severity, and ways to combat its effects. And of course, we'll also be touching on the big question of medication. So, if you're ready, let's get started. Understanding ADD. So, what exactly is ADD? ADD is a neurodevelopmental disorder that affects a person's ability to concentrate, stay organized, and complete tasks. It is important to note that ADD is often used interchangeably with ADHD, attention deficit hyperactivity disorder, which includes hyperactivity and impulsivity as additional symptoms. Today, we'll be focusing specifically on ADD. Common symptoms and identifiers. Let's discuss some common symptoms and identifiers of ADD. These may include difficulty paying attention or staying on task, forgetfulness in daily activities, making careless mistakes, difficulty organizing tasks and activities, being easily distracted, struggling to follow through on instructions. Keep in mind that these symptoms can vary from person to person and may be more or less severe depending on the individual. So, who is most susceptible to ADD? While it's often diagnosed in childhood, ADD can affect people of all ages. In fact, many adults who were never diagnosed as children discover that they have ADD later in life. Research suggests that ADD has a genetic component, making those with a family history of the disorder more likely to be affected. How to diagnose? Diagnosing ADD involves a comprehensive evaluation by a mental health professional who will assess the individual's symptoms, medical history, and overall functioning. This often includes interviews, questionnaires, and sometimes additional tests to rule out other conditions. Severity of ADD. Now let's discuss the severity of ADD. The severity can range from mild to severe, depending on how much the symptoms impact daily functioning. Some people may find that their ADD symptoms are manageable with minimal intervention, while others may struggle significantly and require more support. Combating the effects. Fortunately, there are various ways to combat the effects of ADD, such as implementing organizational strategies like using planners, calendars, and reminders, establishing structure and routine in your life. This helps in reducing the chaos and ensures that you have a consistent daily schedule to follow. You can start by setting up a daily planner or using a digital calendar to organize your day. Breaking tasks into smaller, manageable steps. This makes them more manageable and less overwhelming. For instance, if you have a big project to complete, divide it into smaller tasks with deadlines to help you stay on track. Seeking therapy, such as cognitive behavioral therapy, CBT, to develop coping skills. Remember that there's no shame in seeking professional help. A therapist, counselor, or coach can provide valuable support and guidance in managing ADD. Practicing mindfulness and relaxation techniques to improve focus. Mindfulness practices like meditation, deep breathing, or yoga can help in training your mind to focus better. Incorporate these into your daily routine to improve concentration and reduce stress. When is medication the right answer? It's important to remember that each person's experience with ADD is unique, so there's no one-size-fits-all answer. For some, medication may be a helpful tool to manage symptoms, while others may prefer non-pharmacological approaches. A mental health professional can help guide you in making the best decision for your situation. And that's it for today's video on understanding ADD. We hope this information helps shed some light on this common but often misunderstood disorder. Remember, if you think you or a loved one may be struggling with ADD, don't hesitate to reach out to a mental health professional for guidance and support. If you'd like to learn more about ADD, there are lots of helpful resources online, and your healthcare provider can also make recommendations, as well as school counselors and psychologists. Don't forget to like, share, and subscribe to our channel for more insightful content on mental health and wellness. Join the conversation. We'd also love to hear about your experiences with ADD, so please feel free to share your thoughts and stories in the comments section. Let's continue to educate and support each other in our mental health journeys. Thank you so much for watching. Take care, and we'll see you in the next video.